everybody, we're so glad y'all are here. I'm Emily Russell and I handle marketing here at Clearview, and I am so blessed and fortunate to have two interns with me this summer. They are finishing up their last 2 weeks with me, and I don't know what I'm going to do when they leave because they've tripled my marketing department over the summer. Instead of it being one, it's been 3. So they are very passionate about public health and about educating the public on different topics. And one of the topics that they really wanted to concentrate on was diabetes. I'm sure that none of us in this room are strangers to diabetes. We understand the effects, we understand what that means for individuals and for families, and for you guys just trying to survive and trying to figure out how to best make diabetes work with your lifestyle and kind of what you're used to. So that's what we're going to be covering today. And without any further ado, I'm just going to let them take it away. So go ahead, ladies. Hey, well, I see some familiar faces. Just to reintroduce myself, my name is Kathy, and this is Savannah. Hi. So we had a little mishap, but we're going to go ahead and start talking about diabetes. As you see in the first slide, basically kind of a rerun of what diabetes is. Some of y'all may already know. Do y'all know anyone who's affected by it, or do y'all personally have diabetes? Anyone?
I do.
Know someone? Right. It's actually really common, especially within the United States, with like our diet, our eating habits, our exercise habits. It's pretty common. So we thought it was a pretty relevant topic to discuss today for the Lunch and Learn, so we hope y'all enjoy it. Just to start off, diabetes can be referred to as a chronic disease. So it happens, it can happen over time. However, there are different types of diabetes, and you could be diagnosed at a young age as well. So we're going to go over the 4 major types of diabetes today. It's type 1 diabetes, type 2, pre-diabetes, as well as gestational diabetes. Basically for diabetes, the glucose in your body is too high. So the pancreas makes insulin, which carries glucose throughout your body and gives you energy to different parts of your body. So you have the insulin going to your fat cells, your liver cells, even to your heart. So that insulin gives all of your bodily functions energy and things to carry on throughout the day. So whenever the pancreas isn't making insulin, that's a form of diabetes, as well as whenever your cells are resistant to insulin, that's another type of diabetes. So, whenever your bodies don't have that energy constantly, that results in diabetes. Go ahead and start type 1, which you see on the first slide, or the 4th one, one of them. And it's normally diagnosed in childhood. So, it's more hereditary based. So, if you're more likely to have it if your parents or any siblings have diabetes, type 1. And this is basically where your body doesn't make enough insulin throughout the body. And so you need your daily dose of insulin through maybe an injection, something like that, to get that dose. Otherwise you wouldn't have it because your body doesn't make it. And like I said, family history plays a factor in it. That's a risk factor, as well as environmental factors. So this is like if you come in contact with a viral disease, and then dietary factors, so if you're not eating right, if you don't have enough consumption of vitamin D, which you can get that from the sun and different places like that, but no more than like 25 minutes in the sun. As well as, it's also been seen that geography for type 1 diabetes plays a factor. In Sweden and Finland, they actually have higher rates of diabetes. So that was an interesting fact that we found. For type 2, this is the more common one, and this is typically diagnosed in adulthood, but recently it has been seen to be more prevalent within the younger population. And this is when your cells in your body are resistant to insulin. So it's more something you develop because you haven't been eating right, and maybe another factor is like a risk factor is obesity. If you have more fat cells, then the cells in your body are not as sensitive to insulin. So that's just one of the risk factors. And then diabetes, the type 2 diabetes and pre-diabetes, those 2 types of diabetes actually have very similar risk factors. So they include like age, race, and those are obviously non-modifiable factors. So you can't really do anything mainly about that besides like affect or modify your eating habits as well as your exercise habits. And pre-diabetes is basically where your glucose blood level is above average but not quite yet type 2 or type 1. So keep those in mind. And pre-diabetes is actually diagnosed more prevalent. The incident rate is really high. Each year, 79 million people are diagnosed with pre-diabetes. And then the last type of diabetes is gestational diabetes. And this is when you get diabetes while you're pregnant. So this is more related to women, but you're going to get it as well if you give birth to a baby that's over 9 pounds. Seems to be one of the risk factors, and it gives you a high risk for type 2, getting type 2 diabetes as well as cardiovascular disease. So, and the risk factors are age. Women over 25 that get pregnant are more likely to get gestational diabetes as well. So those are the 4 types of diabetes that we went over. And just like the typical symptoms for diabetes is like being hungry, being thirsty, urinating a lot, and then the difference between type 1 and type 2 tends to be like if you're for type 1, if you're diagnosed, typically you lose weight, and that's because whenever the glucose in your body is, instead of using that glucose because you can't use it because you don't have the insulin, you basically consume the fat within your body, so you lose a lot of weight. Whereas for type 2, you have more like tingly sensations and a lot of numbness. So those are kind of the symptoms to look out for if y'all are curious as to if anyone you know may be diagnosed with diabetes. I'll just show you this back. From 1980 through 2013, the number of adults in the United States aged 18 to 79 with newly diagnosed diabetes more than tripled from 493,000 in 1980 to over 1.4 million in 2013. So the jump is definitely increased, and like I said, it contributes to a lot of different factors and risk factors that we've discussed. And so all 4 of those types of diabetes have increased.
Okay, so I'm going to talk about more of the maintenance and the care of diabetes and how you can kind of go about your life after diagnosis. So some people know that diabetes is a chronic condition, and what that means is that it's a condition that doesn't go away. And we're picking up on slide 13, I think it is. If you want to follow along, there's also an activity after this. So there's going to be questions, so if you have questions for me, I'll be happy to answer them. But basically, a chronic condition is something that can't be cured and usually lasts quite a while, and so that would be diabetes. Let me see how this looks. Okay, so one important thing for people who are diagnosed with diabetes is to know what numbers mean, because you get numbers thrown at you all the time. Your blood pressure, your cholesterol, your blood sugar levels, your A1C, everything is almost in a number form, so it's really important to know what those numbers mean. So on, I think it's slide 14, it has a chart about A1C. Who knows what A1C means and what it tests for? It's kind of a term that is just kind of thrown out there, but basically what A1C is it tests how much sugar is connected to the hemoglobin or the red blood cells in your blood. So typically for a normal person, that's around 6%. For people with diabetes, they want that to be under 7. And A1C tests it tests the blood sugar for the last 2 to 3 months, so that's why you don't have to test it as often as your daily blood sugar. But typically that's tested 2 to 4 times a year by your doctor doing a blood test. And this also has some goals for what you want your daily blood sugar to be, and that's also on your handout. But I'm sure many of you know that for before meals, they want it to be around 80 to 130. And then 1 to 2 hours after a meal, you're going to want to be less than 180 because it will go up because when you eat, you're putting more sugar in your body. So it usually goes up after a meal. So how frequent does anybody have diabetes and want to share how often you check your blood? your blood sugar? Go ahead.
I check mine 4 times a day.
Yeah. Yeah, that's about average. That's keeping really good track of it. So typically, I don't have it written down here, when you wake up, before your meals, and then if you exercise after your meals, really depending on how you kind of get used to it in a routine, and you kind of know when you need to test it or not. But about 4 times a day is really good. But checking your blood sugar is really important because there's a lot of things that can affect your blood sugar. So your medicine that you take, whether it's diabetic medicine or not, can affect your blood sugar. If you exercise, that can affect it. When and how often you eat can also affect your blood sugar. So it's really important to know when to test your blood sugar so that you can stay on top of the levels. Excuse me. So next is just some slides about the symptoms of hyperglycemia and hypoglycemia. So diabetes also has an effect on your blood sugar going too low. So to know that, some of the hyperglycemia, which is your sugar is too high, like Kathy was saying, you can be really thirsty, really hungry, have dry skin, and slow healing wounds is a big part of it. When your blood's not circulating well, your wounds aren't getting healed as well. So that's why your doctor tells you need to have foot exams and eye exams, because sometimes it's hard for your blood to circulate well within your body. Hypoglycemia is low blood sugar, and that's also a problem with diabetics because your blood sugar goes up and down pretty frequently. So we want to keep it more at an even level. So those are some symptoms of that. So there's ABCs of diabetes, which kind of help you remember the most important numbers to look out for. And they're in the handout. But the A was the A1C levels. Excuse me. And B is blood pressure. So blood pressure is really important that you keep that checked. And for a normal person, the average blood pressure is around 120/80. For someone with diabetes, it's about 130 or 140 over 80 is what you want to shoot for. Cholesterol is the C in the ABCs of diabetes, and that's really important to keep track of too. For your total cholesterol, that's what people mainly look at. You want to keep it below 200. Your LDLs are the bad cholesterols, and you want to keep that under about 100. And there's a little chart on your slides that shows all the different cholesterol levels, but those are the two we want to look out for the most. The next few slides just kind of show a variety of the different kind of exams that you want to continually have on an annual basis with your doctor if you have diabetes. So one is vision or eye exams, to have your eyes checked out and get dilated so you can have them checked for glaucoma, or loss of vision is an important thing to be aware of. You want to do that about once a year. And if you go 1 year and there's no problem, sometimes they'll reschedule you for every 2 years. Foot care is also a really important thing, as I'm sure many of you know. Once a year is about the time that you want to have your feet examined by a podiatrist. But it's important that you look at your feet every day. So whether you have calluses or dry feet can become cracked and infected. So it's really, really important that you keep an eye on your feet, because you can lose when your circulation starts to go bad, you can lose feeling in your extremities. So your feet are very, very far from the rest of your main circulation, and you can lose feeling in them. So when you get hurt or when you have cracked feet, you may not necessarily notice it right away. So smoking is another important thing. Just kind of for every health issue, we don't want to smoke because it just makes your circulation worse. It makes your heart and your blood worse off. So that's just an important thing all around, to not smoke. And how does diabetes affect the body? So diabetes basically affects your whole body. It affects your kidneys, it affects your nerves, your circulation. As we talked about your feet, it can affect your eyes. So it's really, really important just to kind of have a whole body check at least once a year, a physical. So to recap, prevention of diabetes is a big factor of it. So watching your diet, exercising well, but like Kathy said, it's another big part, or another big part of it is family history. So you can have a family history and work out all you want. You might still be at risk for diabetes. So it's important to know those risks. All right, and that is our physician referral line. If you don't have a regular physician, we can hook you up with somebody. But I am going to go to our activity. If anybody has questions, go ahead.
A1C. What are the plus and minus? What's the average?
Average? Well, I don't know the average. I know the goal for someone without diabetes, it's going to be less than 6%. You don't want, I'm not sure about the plus and minuses, but less than 6% is the goal for somebody without diabetes. And if you do have diabetes, they want you to be less than 7%.
Well, mine is 100, 99.
It's not the same kind of figure though.
Yeah, I would say that's probably not the A1C.
I mean,
That might,
cardiac, I did it. We've been talking about. So you don't know what that means.
I don't. I usually,
Oh,
Is that your blood sugar?
I don't know.
If it's 100, that's good.
It's on my A1C on my blood chart, on my blood chart.
well, isn't
I'll
A1C?
find out what it
Yeah. Typically, I see A1C listed as a percentage, but there may be some kind of new technology that lists it a different way that I'm not aware of.
He said that I need to tell my regular doctor to start a pre-diabetic care
Okay.
because of that.
That's an average over 60 to 90 days.
Mm-hmm.
If you were averaging 100, you would have some very low numbers to make up that average.
Right. That might be your blood sugar because around the 99 to 100 range would put you as prediabetes. So I bet that's what it is. Probably. But yeah, I would check just to be sure because I'm not 100% sure. So our game, it would have been better if I could have had the TV, but we'll just try it on the little screen for right now and see if it works. Okay, so this is kind of like, it's called Spin the Wheel, but it's kind of like Jeopardy a little bit. Well, I don't know, maybe Wheel of Fortune. I don't know. Okay, so spin the wheel. We're not going to do this part, but we're going to spin the wheel. And then there's going to be a question, and y'all can just yell out the answer. So this is pertaining to feet. How often should you look at the bottom of your feet?
Every day.
Every day. Yay, good. All right, spin the wheel. Eyes. So which one, we didn't really look at this, but which one, if y'all can see it, does it look like is the healthy eye?
A.
This is A and this is B.
A for sure.
A, yep. Spin the wheel. All right. What are the ABCs of diabetes care? What's A?
A1C.
What should your levels be?
Under 6.
Under 6, under 7? Yep. What about the B? Blood pressure. What's the range for that? What goal do we want to shoot for?
130 over 80.
130, 140 over 80 is a good range. And the C? Cholesterol, good. And what's the level we want to shoot for that?
200 and 100 for the LDL.
LDLs, yeah. So the LDLs are the bad cholesterols. We want those to be less than 100 and total cholesterol under 200. Good. All right. Is blood pressure and blood sugar control important for healthy kidneys? That's kind of an easy one. Yep. And who can name 2 examples of risk factors associated with diabetes? And that can be any kind of diabetes, like she talked about type 1, type 2, gestational, and prediabetes.
Overweight.
Overweight?
Family history.
Family history? Do y'all want to keep yelling out some?
Location.
Locations? Yep.
Smoking?
Smoking? Yep. Family history is a big one. What are some other ones?
Age,
Age, race, exercise, and diet. Yeah, and then I don't know if you mentioned, if you do have prediabetes or if you have gestational diabetes, it's a lot more common that later in your life you're going to develop type 2 diabetes. So that can be a risk factor as well. All right. What are 2 causes of high blood sugar? And this we didn't go over in the slides, but this will be on your handout. So there's a section on in the little brochure that you got that has, what does it say?
Causes and
So it has the causes of high blood pressure and then sugar, I'm sorry. Causes and symptoms of high and low blood sugar on the inside.
which you'll see the some that relate to the symptoms of just having diabetes that you should look out for. So some of those are having too much food, like Thanksgiving dinner. I always eat too much. Too little exercise, too little of any medicine you're prescribed for, stress, injury, illness, any of those can affect your blood sugar. All right, and that's the end of our game.
Question.
Yeah.
The meal we just had is probably about 500 calories. Do you know for sure?
Probably. I'm not positive.
How much would we expect our glucose to increase 1 hour after eating?
That's a
kind of
good
meal?
question. I think so. That would really depend on what kind of meal you were having. But that one has pasta, so it has a lot of carbs that can turn to sugars. You don't have a whole lot of sugar in your dessert, it looks like. So I would say probably not a tremendous amount because it's fairly low in sugar, it looks
Typically
like.
about
but
100, right? An
Yeah.
increase about 100.
I would say, I'm not positive, I'm not super expert, but yeah, I would say that's a good guess. Yeah. Any more
I've been
questions?
doing this since 1990. I learn something every time I go to a new seminar. But just recently I did one and was reminded glucose increases are 100% dependent on carbs.
Yeah.
No other foods cause your blood sugar to go up. And if I'd known that before, I'd forgotten it.
Yeah. Yeah, that's a good tip to know.
When you read the food label, it includes for the carbs, it includes the starch and some of the sugars as well. So it's important when you're looking at food labels to look at the carbs. Definitely important.
Before we do any more questions and before I forget, I'm going to just point out on the back of the brochure that y'all got is a little insert about something that we have going on this Saturday. And I don't know how many of y'all are aware of the farmers market that goes on in downtown Monroe, but this Saturday I will be there doing a food demonstration and preparing a little snack. And it's a diabetic friendly snack. I guess I can tell y'all what I'm making. I'm making peach salsa, and I actually tried it out last night. It's really, really good. I brought some to Kathy this morning. But, so we're going to be having that, and so a lot of the vegetables that you use are cucumbers, peaches, a lot of things that are in season and you can get from the farmer's market. So we'll be there this Saturday. The demonstration, I think, goes on at 10 or 10:30. There'll be free samples. And they'll also have a Clearview tent there doing blood pressure checks and some different kind of education on nutrition as well. And we will, we also have for this recipe the nutrition label printed out for it on recipe cards that we'll have on Saturday. So we'll also be able to kind of look at the nutrition labels there and kind of educate on what you can look at and look for on a nutrition label. So are there any more questions?
Mine, I became a diabetic by my medication that I take. I take prednisone, and I take one like in the morning and one at night. But in between, I be extremely hungry, and I overeat all the time. So my sugar is, when I get up in the morning, my sugar is like 200 plus, you know, and that's before I even eat anything. And it's all because of the medication.
The medicine.
As it is right now, until they put me on an arthritis medicine, that's all I got to depend on. That's all I help keep me going.
Yeah.
And it's real hard for me.
Yeah, I'm sure. Yeah, prednisone is kind of known to make you hungry, so I can see kind of where that comes from. And medications could definitely be a risk factor for diabetes because medication can do crazy things. So you may be taking it for one thing and they give you another crazy side effect that you have to worry about then. So yeah, that's absolutely a risk factor as well.
And it affects your metabolism too, and that all coincides with how the glucose is run throughout your body. And you know, if you're building your body to, you know, if you're eating more, then you have more fat cells, which means that those fat cells are actually not as sensitive to insulin as, you know, other cells. So that's why you don't absorb insulin like you should. Mm-hmm. Instead, it's all in your bloodstream. You're not using it like you should. And so definitely all of it coincides.
Any more questions or comments or thoughts?
What is the senior group here at the hospital called? Is that it?
Senior Circle?
Okay. Mm-hmm. They still have an annual meeting?
I think so.
They have the newsletter too that it sends out monthly. So if you wanted to get your email down on that list, you can find out when like the other meetings are. We'll get your email.
On the list of them. I know before you moved out of the old building here, the health fair was an all-day deal. I have it at different doctors who did all kind of actual examinations. And I think since you moved here, you haven't done that.
Yeah, I'm not sure. They've been here, I think, for about 3 years.
Dr. Phelps was the podiatrist who participated, and I've gone to him up in Loganville.
Okay. That would be good for them to do again, but I'm not sure when they have that planned. But I'm sure it was.
I know they plan on doing one soon, because I remember Emily mentioning that she was working on something like that. The senior health fair.
East Side has a program called Health to You, just for diabetics and primarily seniors, and they have a monthly meeting with a professional,
Okay, awesome.
and a podiatrist and endocrinologist, something related to diabetes every month.
That's awesome.
We attended that a lot when we lived in Gwinnett.
Definitely, we'll have to keep that in mind. That's awesome. Yes, ma'am.
I noticed the family history was down the line, but I'll just make a comment that my grandmother had diabetes, and I thought my dad had never been overweight. He thought he had escaped, and he was diagnosed at 85. And then I was watching for it, so I got mine really early, and I'm just on one pill a day. My brother is an exercise fanatic, doesn't weigh a pound over. He just knew he was going to stay. He is now on 2 pills a day. So, and I know I have at least 3 first cousins that are. So that's why I was saying, in my particular case, I have a strong family history.
Right.
Definitely.
But I'm thankful that mine has been easily to control. And
Whenever you're aware of it, it makes it that much easier. That's why, you know, spreading the knowledge, and especially if you know your family history, you know what to look out for. So you're helping eliminate some of those risk factors, and you know it won't be as hard on your health if you find out early and help maintain it early. Still gonna have to do some type of maintaining, especially since it is in your family. So, but it's good that y'all found that y'all like are aware of it. It's really good. Family history is definitely a very strong factor in determining whether or not you get diabetes. I'll share that my mom, she actually was recently diagnosed with type 2 diabetes. So I know within our family it isn't as prevalent, but I know that, you know, with her work schedule, she doesn't have time to eat as a nutritional meal as we should. And so I know that those habits have obviously been carried down to me, so that's something I am going to be aware of and try to be aware of. And then my dad has high blood pressure, so those are other risk factors as well with diabetes, and I don't want him to get diabetes, so it's just kind of a family effort. So I think surrounding yourself with that knowledge and people who are affected by it helps you gain more knowledge. And I know my mom, she had to start doing the pricks to check her blood glucose levels, which I'm just happy to see her take that initiative, and because you have to, otherwise if you don't, it's going to get worse. And and she's always had vision and different. I remember the symptoms when I was a little bit younger. She would be like, I gotta run to the bathroom, and I remember her having those. So it's weird to see I wish I would have known that, to be like, you need to go get checked out sooner. So just be aware of kind of stuff like that. She would always be thirsty, and so it's really nice to kind of see it firsthand. She drank a lot of diet sodas, and that's just even worse for you. So you shouldn't have any type of soda. it just it has the same effects on the body. Even though it may be 0 sugar, it still has the same effect. There's not much of a difference. So I definitely recommend no soda at all. So that was one of her things too. Doctor said you have to stop.
Yeah,
You
and
have
that's a big kind of misconception from a lot of people who may be at risk for diabetes or just diagnosed with diabetes. Like you were saying, carbohydrates are a huge part of, and like you said, 100% of what makes your blood sugar go up, because people don't realize that it may not have sugar, but there's a lot of carbs, and carbs turn right to sugar, so it can make your blood sugar skyrocket.
That must have been a pretty healthy meal, because mine just went up 20 points in a half an hour. I thought I remember being told that you could expect about 100 points.
That's
And
zero.
when we started, I'm having some problems right now due to the holiday weekend and eating too much barbecue probably.
Yeah.
So I was at 226 this morning, 245 at noon, and now 265.
But it has to be 2 hours after.
So, so that must have been a pretty healthy meal to
Well, good.
not raise it more than that.
Yeah, that's really good.
Stick with veggies. They're always yummy. Get a good variety.
That's a good point. I'm glad you were looking at that. That's a good eye. Good eye.
Are you ever going to be an endocrinologist?
No.
We just
No
like to
problem.
spread the knowledge of health promotion.
Right.
But if y'all need a specialist, we will definitely direct you towards a specialist. That's our job.
So where are you girls off to?
Well, we just graduated from UGA. She may stay here at Clearview. Who knows? I have no idea either. But definitely continue health promotion. And, you know, we enjoy spreading the knowledge. We want people to be healthier. It's very important to us to be healthy. And, you know, what better way than to spread the knowledge?
Yeah. Yep, we just graduated with health promotion.
So it's been fun doing these. There will be, the next one is August 11th, and we'll actually have Sandy Hop here. She is the nurse practitioner for the new Social Circle Clinic. She's awesome, and she'll be talking about, you know, just overall senior wellness, and she'll have like some specific details of the lecture coming up soon.
Well, I actually talked to her this morning just to kind of remind her that she was going to be coming on August 11th. And I think we've settled on a topic, and the topic is 99% sure going to be about vitamins and supplements. So she'll be able to come and talk to you about different vitamins, what their benefits are, what you can expect when you take them, how much should you take, what do they do, and the specifics on a lot of different specific ones. And what I could do, if y'all like, if you have any specific requests on a certain vitamin, if you want to tell me as you leave, I can write them down and send them to her so she knows what to focus on if y'all have certain questions on specific ones.
Vitamin D